Fresh. Hi everyone, my name is Lucy. Today we're talking about postpartum uterine pains. This is the pain you feel after delivery. So if you are a new mother and you are wondering if this is normal, please stay tuned. After pains as is being called, or that abdominal cramps you feel after giving birth to your child is normal. This is because before now, your uterus has its size. Then when you must have taken in, it needs to expand to accommodate the size of the baby. Have you ever wondered why, if you're carrying a child or you're carrying triplets or even quadruplets, the same mother that carried a single child can be able to carry 5 babies at the same time? This is because as you are carrying your child and the baby is growing, your uterus tends to expand so as to accommodate the size of the baby. So immediately after giving birth, the uterus will now start shrinking and the muscles will start tightening so as to go back to its normal size, and this is what is causing you pains. This pain is always severe when you are breastfeeding, because during breastfeeding a hormone which is known as oxytocin is being released, and this particular hormone will now help to increase the healing of the uterus. Sometimes after delivery, if your healthcare provider is someone that knows what he or she is doing, they always palpate your uterus to make sure that it is contracting. And when this is not happening, you'll find out that that particular woman will start bleeding profusely. These after pains always occur within first few days of delivery, and it can last up to 1 to 2 weeks. There is no cause for alarm. You only call for attention when, one, that you are having fever and you are still having those severe pains. Then secondly, that you are bleeding profusely to the extent that clots is coming out from your body, or you are seeing a foul smelly discharge. In this scenario, you have to call the attention of your health caregiver. Then another thing I want us to discuss is this: the only remedy to this after pains is by massaging that particular area you're feeling that pain, which is at the lower abdomen first. Then secondly, you can use hot compress. Another thing you can do is to take paracetamol or any pain relief drugs. It's going to calm the pain at least for a while. But if you observe yourself, you will notice that the pain is always severe when you are breastfeeding. So because of this, do not use it as an excuse not to breastfeed your child, because breastfeeding helps the uterus to heal faster. So each time you give birth to your child and you're having these feelings, do not be scared. It's normal. Then these pains always occur, especially to those women who are giving birth to more than 3 to 4 children. If you're a first-time mother, like a primate that have just given birth, it can occur. Like 50% of women do not experience it at this rate. But if you have given birth to 2 or 3 children, you will now see that you might have this feeling of pains I'm talking about. But one thing I want you to understand today is this: that it is normal, and it doesn't occur to every woman that has given birth. Some people feel it, whereas some doesn't. So if you have that feeling, it always felt as if you are still going through labor pains. The way the labor pains feel, that is how you are going to feel this particular pain I'm talking about. but it's something that you can deal with. And um, if the shrinking and the tightening of this uterine muscle did not occur, that woman will start bleeding. And if you're a mother who are giving birth, you can also feel you can feel your uterus by touching your abdomen, your lower abdomen. If the uterus is contracting, how you are going to know is this: you are going to feel a hard mass like a stone. It will seem as if you are touching a stone. So, but if you touch your abdomen and it's not happening, it means that something is wrong. By the shrinking of these uterine muscles, it tends to expel every other fluid and the retained product of conception that is still remaining inside the womb. So it is very, very necessary that this shrinking of the uterine muscles must occur. Some feel the pain, whereas some doesn't. So if you are someone that feels that pain when it occurs, please do not be afraid and understand that this is normal thing that happens after delivery to some women. If this video has helped you in any way, or you're able to learn something today, please like, comment, and subscribe so that if I happen to drop another video, you can be the first person to watch. Thank you so much, and goodbye.